How are you doing today?
I'm doing okay, thank you.
What brings you into the office?
Ooh, a few things. My upper back, my neck, and my shoulder. I have a lot of tightness.
Okay, can you go ahead and point to that pain?
Yes. Right here in my shoulder. This area on my upper back here. And I'd say my whole entire neck. It feels really tight.
All right, well, let's go ahead and get you checked out, see what we can find, and then we'll go from there. So you said you had some tightness up here in the shoulders. I'm gonna take your head over to the side this way. Okay, you see how you can take your head to the left a lot farther than you can to the right this way?
Mm-hmm.
See how it locks up there? Okay. Go ahead and cross your arms in front of you. Perfect. Go ahead and turn to the left. Okay, and then turn all the way to the right. Okay, see how you have a lot more range of motion to the right there than we do to the left?
Oh, no.
Okay, we'll get you adjusted there. Now relax that shoulder back for me there. Okay, other side. Okay, I'm gonna have you bring your hips just a little bit closer to the table. Perfect. Go ahead and bring this top knee, straighten out the bottom leg for me. Perfect. I'm gonna take this hand. Good. Now I want you to just relax that hip there for me. Good. Relax the shoulder back. There it is. Easy. All right. Your back here. Good. Take a big breath in, big breath out. Okay. When you're ready, go ahead and sit up. Face out. Good. Now we're going to cross our arms again. Okay. And now see how you can turn more to the left? Perfect. All right, go ahead. Do it again. See here you have more flexion to the left. And here you have less flexion to the right. See how it gets stuck right there?
Yes.
Let's check the rest of your neck here. Okay, and then see how it gets stuck right there. Down on the right side. With the left side, we can take it all the way to the left. Okay, so let's go ahead and get that adjusted. Get off your head. Alright, now let's check that neck again. And now see how we can take it all the way to the right.
Yes.
All the way to the left. Perfect. Alright, how are you feeling after your adjustment?
I am feeling so great, thank you. I am really happy. I feel a lot less tense. I feel like I can just move. I don't feel like a rock, which is nice. And I'm really happy. I'm smiling a lot. As soon as you were finished, I just couldn't stop smiling, so this is awesome.
Alright, thank you for coming in. Can't wait to see you again.
Thank you.